Hi, I'm Dr. Bill Carlazon, Principal Editor of NPP Digital Psychiatry and Neuroscience. Welcome to the DPN Deep Dive, our journal's AI-generated podcast that summarizes DPN articles in short, accessible episodes. Each episode is created using Google's Notebook LM, refined by our tech-savvy social media team, and approved by the authors to ensure clarity, accuracy, and approachability. Let's dive into this episode to explore the latest research in digital psychiatry and neuroscience.
So imagine this, a conversation with an advanced computer program, one that could actually help doctors better understand and treat mental illness. Yeah, I know, it sounds like something straight out of science fiction, right? But it's rapidly becoming a core topic in mental health care today. We're diving into a review article titled Opportunities and Risks of Large Language Models in Psychiatry. It's written by Nick Obradovich, Sahib Khalsa, and their colleagues. They're at the Laureate Institute for Brain Research in University of Tulsa, in Tulsa, Oklahoma. Okay, so when we start exploring these large language models, or LLMs, in psychiatry, what really jumps out is just how quickly their capabilities are evolving. I mean, we're talking about systems that can process just vast amounts of information and generate really human-like text at scale. So what are they actually, bringing to the table in mental health care? What are the specifics?
Well, it's the speed, really, and how that speed could transform things. It's not just about, efficiency. It's potentially a fundamental shift in access and even diagnostic precision. They can assimilate patient data incredibly quickly, summarize therapy sessions, which is a huge time saver, and even help out with complex diagnostic problems. There was even one study, quite interesting, that found an LLM performed just as accurately as human clinical assessors when it came to projecting psychiatric functioning.
As accurately as humans? Wow.
Yeah. And we're also seeing them used to power therapy chatbots. You might have heard of the Lumen system.
Vaguely, yes.
Well, a pilot study showed it led to, modest reductions in depression and anxiety symptoms. But what's really disruptive, I think, is that a version of Lumen was apparently created using ChatGPT-4 in less than an hour.
Under an hour?
Yeah. It just highlights the potential for incredibly fast development and maybe more personalized interactions down the line.
Okay, that speed is impressive. Building something that quickly that shows any results. But, for our listeners, modest reductions might sound a little, underwhelming compared to the hype.
Mm-hmm.
Is the real breakthrough here more about getting some help to more people, maybe? Accessibility?
That's a big part of it, exactly. It's the scalability, the rapid deployment. It could offer accessibility that's just, far beyond traditional therapy for a lot of people. And if we sort of zoom out a bit, LLMs aren't just for direct patient care. They could reshape how entire health systems are managed.
How so?
Well, for example, there was one health system where they trained an LLM on clinical notes, and it successfully predicted things like patient readmissions and even, get this, insurance denials.
Insurance denials, wow.
Yeah, leading to the potential automation of, some pretty significant administrative decisions.
That potential for automation, like predicting insurance denials, it sounds incredibly efficient on one hand, but I can already hear listeners thinking, it raises that specter of a cold algorithm making judgments instead of a human, especially in healthcare. So what should we be most cautious about here? What are the big red flags when we think about bringing these LLMs into such a sensitive field?
Right, and that's the crucial question. I think the real danger isn't just that they can be unpredictable or biased sometimes, though that's true. It's how those flaws can scale up almost instantly, impacting population mental health in a way that one single human clinician's error never could. LLMs can and do produce factually incorrect info, sometimes even completely fabricated stuff like non-existent citations. That makes reliable clinical use really challenging.
Fabricated citations. Okay, that's worrying.
It is. And another major risk, thinking about population mental health, is this potential for users to maybe substitute actual human interaction with these, often quite pleasant AI conversations. It kind of mirrors the concerns people have raised about social media and its impact on loneliness.
Yeah, that makes sense.
Yeah.
Trading real connection for something easier, maybe?
Potentially. And then, of course, there's the bias issue. LLMs can embed biases from the massive data sets they're trained on. And naturally, huge privacy concerns. The potential for data leakage of very sensitive patient information is a big one.
So, given these pretty profound risks, the inaccuracies, the bias, the privacy, this potential impact on human connection, what does the article suggest we do? How do we build the necessary guardrails to make sure these tools are used safely and effectively?
Well, it really emphasizes the need to establish responsible guardrails before widespread deployment. Things that anticipate and mitigate these challenges. The article specifically advocates for practices like red teaming. That's where experts actively try to break the system, essentially, to find vulnerabilities and potential harms, especially thinking about psychiatric uses.
Like stress testing the AI.
Exactly. And frameworks are being proposed, like the biological, psychological, economic, and social or BPES framework. The idea is to assess an AI system's safety across the board for all stakeholders, patients, professionals, the industry, even government regulators. But critically, what the authors stress is that successful integration absolutely demands interdisciplinary dialogue and research. It can't just be clinicians and tech people.
Right.
You need individuals with lived experience, family members, policymakers, ethicists, everyone at the table.
It's quite a deep dive we've taken into this really fascinating but clearly complex world of large language models in psychiatry. We've seen this incredible potential, haven't we? Revolutionizing diagnosis, therapy access, even streamlining admin tasks. But the challenges are just as vast, unpredictable outputs, bias, and that really delicate balance of human connection.
Absolutely. The future of mental health care, it seems clear, will involve sophisticated AI in some form. There's probably no avoiding that. The real challenge for us and for you listening is to make sure that as we, maximize the potential benefits of these really powerful tools, we are just as rigorous, maybe even more so, in developing the ethical and safety guardrails, ones that are strong enough to mitigate the risks and ensure these technologies actually enhance human well-being, not detract from it.
A crucial point to end on. Thanks for joining us for this deep dive. Goodbye for now.